joined by Dr. Bharat Pankhania. He is a senior clinical lecturer over at the University of Exeter's Medical School. Doctor, always good to have you on the show. So I ran through the countries, and each one seems to be implementing a different sort of course of action. The Omicron has been sort of in our lives now for the past several months. Are you at all surprised by how this is progressing, and more importantly, how countries are reacting to it?
Unfortunately, we have quite a lot of political expediency as well. So we have countries where the case numbers are high. You mentioned India and other parts of the world, Hong Kong as well. And then we've got Denmark and the United Kingdom, where whilst the background number of cases is very high, we have withdrawn most restrictions and infection control measures. And the reason why we are able to get away with it within reason, and it is really within reason, is our population is heavily immunized and also boosted. And we've now got a clear decoupling between being vaccinated and not ending up seriously ill in hospital. That's why we've been able to relax on our restrictions.
Okay. You and I have talked about sort of big pharmaceutical companies sort of tweaking their vaccines. We know that Pfizer is working on this. The European Union had just come out and said that they've approved the use of Pfizer's COVID pill, which would be the first oral antiviral treatment for the disease. It looks like we could have this under control.
It's difficult because with respect to medication, they only work well if taken early in the course of an infection. So there are a lot of logistics issues, especially as with SARS-CoV-2, many people are infected without any symptoms. Therefore, we don't know if they need those pills. And in the meantime, they go on to infect other people. The other worry is that unless we suppress infections in Africa, India, Asia, other countries, we have a danger of variants of concern arising. So we are not out of the woods until we suppress infections all over the globe.
Dr. Pankhania, you also mentioned that we're actually seeing, when you look at the trends, a decoupling. You also mentioned sort of poorer countries. Talk to us about the risk of further variants arising from this region of the world and, from this world.
So what happens is this is a RNA virus. It hasn't got a checking mechanism. So when it is reproducing in many people over many days, these mistakes in the reproduction of the RNA virus are multiplied, and by random chance, if the mistakes are in the right direction for the virus, a variant of concern can arise, exactly how Alpha, Delta, and Omicron arose. So we really need to suppress repeated infections in many people all over the world. And the one other ray of good hope that we have, by the way, is vaccines are being developed which don't rely on the spike protein changing its shape from these mutations. So once we've got a successful vaccine which doesn't rely on a spike protein that keeps on changing its shape, then I feel we will be entering a better management of the pandemic all over the world.
Doctor, let me ask you then, I mean, with this latest variant, Omicron, one of the distinguishing characteristics is that we saw multiple or a very high number of mutations in the spike protein. So I don't quite understand your analysis on the type of vaccines that's needed then.
Oh, it was very easy, and I'm so pleased to be able to explain it to you. So we have the spike protein, which the coronaviruses have, but they also have other proteins in other parts of the virus. And these other proteins are usually the same. In other words, they're not subject to lots of changes in its reproduction. In other words, if it is going to be a survival virus, that protein is always present. And what we need to do is target a vaccine against that protein, which is always present.
Okay.
That does exist. We know that they exist. We know that they're there. All we've now got to do is develop a vaccine against it, and hopefully we make immunity against it.
Bharat Pankhania, always a pleasure having you on the NewsHour. Thank you.